Hey, everybody. Thanks for being with us. Andrea, thanks for being with us. I want to take a minute to talk about the change situation because so much has happened, and I want to just underscore the gravity of it. So the latest estimates I looked at, 1/3 of Americans have been affected by this. The company is still trying to return its claims and payments flow to normal. It's still not happened yet. The financial losses were estimated at $100 million a day for the general, everybody affected by it. Obviously, there continue to be patient care disruptions, and by the way, all those inefficiencies to mitigate all the systems that had to be put in place when the primary systems were affected. So in tech, we always say it's not a matter of if you get hacked, it's when. So Andrea, I would love to start with you, if you don't mind. This is about trust right now, yeah? So what do we do about that?
Well, first, let me share a little bit of my backstory and how I got to here. I am a breast cancer advocate, patient advocate turned security researcher or white hat hacker. And I started on this path 5 years ago because we saw that nobody was coming to save us as patients. And, a lot of the folks that have been in healthcare cybersecurity for decades have been warning about these types of attacks on our infrastructure. And now we're only seeing them get bigger and worse and exploited in ways that can cause loss of life. So is it about trust? Absolutely. I don't think of trust as an emotion anymore. I think of it as a way that we can accurately predict benefit or harm. And, I think when we look at the current state of healthcare cybersecurity in this country, it's really, really bad, and we need to do a lot to move forward.
Good. Stephen, I want to come to you next because you've worked in cybersecurity before, your current role. In security, when you create a door, the good guys can walk through it, the bad guys can walk through it. How do you balance that in this situation? Because everybody wants the capabilities to move the data around and enable more care and all that sort of thing, but we clearly know what happens when it goes bad.
That's true, and security used to be, people would think about it as a perimeter. Let's put up this perimeter and let's protect the bad guys from coming in the perimeter. And a lot of the security structures of today are a result of what I would say is an antiquated perimeter kind of mindset, because you have to think of it as the bad people are already in the perimeter. It's how do you protect the data and the information, the intellectual property that is critical to your business, critical to your infrastructure, even critical to your government. And to do this, it's not just, we were talking out in the break, it's not just about buying some spectacular piece of technology that you deploy and everything turns into a secure rainbows and butterfly scenario. That's not how it works. You have to really bring together the people component. For example, the Change Healthcare, what we do know about it publicly is it was a black cat operation, which is a Russian organization, but it exploited very simple configuration issues with multi-factor authentication and what they call credential stuffing. So they basically got a username and password, were able to log in, and it didn't send them a text or ask them to use their app to authenticate. There's no amount of technology you can buy that will stop the human part of that security infrastructure. And in this case, I think it's a human and technology together that are gonna move the needle. It's not just your IT department buying some spectacular piece of security software.
Well, so what do you do about that, if you don't mind me pressing? The humans are not going away in our companies, I surely hope not. So
I think there's a few things you need to do. One is if you're thinking about this in your day job, look at the public-private partnership opportunity. So NIST is a framework and organization, a standards body. They came out with security, I think it was in 2013, over 10 years ago, version 1.0 of the NIST framework, which was designed to help organizations navigate creating a security profile for critical infrastructure, utilities, power, railroads, et cetera. They've now, and earlier this year, did a much needed NIST 2.0 framework, which takes that same expert public-private collaboration of 1.0, but expands it to all of healthcare and all of the services and infrastructure. Use that because a lot of companies, we were a part of that at my last cybersecurity company, we were a part of working. So you have to get a coalition of the willing. You have to look at public-private. You have to look at academia, and you have to look at your ability. Think about most of these regional hospitals and these regional organizations that are getting hacked. They can't afford oftentimes the Goldman Sachs or the Google level security talent. It's very difficult for them, so they have to partner with these companies in order to increase their posture. And look at the motivations of the bad guys. In this case, which sounds like an odd thing to say, the fact they were after monetary gain, which is we're going to encrypt the data and we'll give you a key to unencrypt it, is a good thing because monetary gain you can solve for. The more dangerous one is the nation state that's not in it for monetary gain, and they're not in it to discuss with you your data, and you may not even know that they did the deed. They're the most dangerous tier of security, but the public-private partnership, I think, will take average or even below average security postures and make them good or great, but it requires you not try to do it all by yourself.
So real rainbows and butterflies here you're painting for us. Yeah.
More little waterfalls and maybe a stream. But.
Okay, fair enough.
If it was just that easy.
Yeah.
Right, all these rainbows and butterflies. Like, look, the NIST framework, we use that at Athena Health as well. I think it's a great framework. I would encourage everyone to do that. But as you think about kind of what has occurred with events like this, and the reality, I think you said it, Andrew, is that you either know you've been hacked or you don't know you've been hacked, right? It's like people can be inside your structure. And I think the real element is about resilience. And what do you do about it? I mean, resilience is about what do you do when conflict arises? What do you do when something goes wrong? And I think in the healthcare system, it's not just about technology. I mean, everyone's working on endpoint detection and multi-factor authentication and logical separation of databases and making sure that only certain people have like all the access codes to the data, active replication, putting things in a situation where you can easily recover. But it's also a lot more than technology. When I think about resilience in healthcare, it's about these practices that almost lost their business. We talk about 50,000 short primary care physicians in the United States. Think about all the independent docs in rural America serving underserved communities that literally couldn't make payroll. So we got to think as an organization and a set of organizations as an industry around how we drive alternative pathways for connectivity. So if something like change happens, what is the alternative? Electronic health records, how do you go to paper if you have to? I mean, it's a terrible thought, but how do you do that? And how do we build an economically resilient system that allows these practices to thrive and to survive?
I think they're also, and just to add to what you said, I think it's great points, is what's the government response to the change? In my world, that's almost an act of war. That's that level of aggression towards infrastructure. Those are people's lives, their personal information. That is not something that should just be a tech issue that we're solving for. There needs to be, I think, a geopolitical disposition that updates countries when, if you were to sink a U.S. ship off the coast of a different country, or it should be taken with that same level of seriousness above and beyond the technical response. And I don't know what the U.S. and other countries are doing to elevate. So when you do compromise U.S. or our allies, like we view that as a much more elevated event than I believe it is today.
Yeah, well, that one's above my security clearance. Andrea may have one though.
I just want to tag on to a couple of these comments. First of all, I think cybersecurity and healthcare truly takes a village. We can no longer assume that what happens within our firewalls, within the walls of a HIPAA-covered entity, is going to be good enough. If we're checking the boxes on SOC compliance, on HIPAA compliance, those things are going to work. Hackers don't care, especially if they're nation-state actors. We're reaching a point where our ability to protect and respond, if we're thinking about the NIST framework, is not being, these attackers are outpacing what is actually out there within the ecosystem. And what I'm finding, and I'm just going to give you a couple of anecdotes, we were navigating earlier this year something with CISA where we're starting to see infiltration of clinical research, right? And people, when you think about 80% of ransomware attacks are first leverage what we talked about in change with the password stuffing issue, but with phishing attacks or social engineering attacks. We're starting to see that with patient communities and clinical research where we're impersonating patients, we're impersonating physicians. And going back to this idea that it truly takes a village, we need to start training up our army within our workforce and recognizing the second that they leave, the walls of a clinic and outside of our firewalls, we are also, consumers who are being targeted with the data that we post on social media, where we are buying things and using these consumer-driven technologies that have really poor privacy. These are ways that we can, target our workforces and our population in ways that are not protected just because it wasn't part of the checkbox for SOC compliance and HIPAA compliance. So I have a bit of a soapbox here, but I would definitely agree with everybody on this panel. I'm also noticing that, going back to that example of infiltrating clinical research and having to navigate this, we've got to ask ourselves, where are the coordinating bodies? Today we have NIST, but within healthcare cybersecurity, we have HISAC and BioISAC. We have to expand capacity beyond just one healthcare system sharing intel with another, but really to build resilience, we're going to have to shore up, as you were saying, the public-private partnerships and funding and infrastructure to really get ahead and detect and respond to these attacks.
Yeah, I think to add to that, the unemployment rate, if you're anything in security right now, is 0%. There's more need than there are people with security expertise. And for that to change, I think what Andrea said, we need to have education and a workforce. So it's not just your security team that worries about this, but it's all of the company. There needs to be a culture of security and privacy, particularly in healthcare. And the kinds of attacks, okay, we see Change Healthcare, but for every Change Healthcare, there's very sophisticated attacks that you don't read about that are quite scary. I'll share one story we talked about in the green room, started to. This was shared to me by a security executive, and it's okay to share publicly, is the Dalai Lama. It's a story about the Dalai Lama. The Dalai Lama had prostate cancer a few years ago, was going in for external radiation treatment for his prostate cancer. Well, there's a specific nation state that doesn't support the Dalai Lama, you can guess who had worked to infiltrate the radiation system, so when the Dalai Lama went in for his treatment, they would deliver a lethal dose of radiation in order to take out a political opponent or a political dissenter. Now, they caught that hack, and they were able to protect him, and he was able to get his treatment. But had that happened, you would just read the Dalai Lama passed away due to a radiation exposure, and you'd never know the sophistication of the attack that was going after that political dissident for that particular country. And when you start, and I live in this world for many years, when you start hearing these kinds of asymmetric stories, that's why the term warfare comes to mind, because we have to respond to this almost like a NATO for security and have all of the organizations around the world working on the things. No one country, no one city, and definitely no one industry can solve this problem on their own.
The stakes are different for nation states, and they have different motivations, and it's not always economic. And like you said, the non-economic is the most pernicious and frankly the one that scares you the most. And you start thinking about AI, and we're talking about AI all over this conference, right? And I start thinking about China, and I start thinking about other nation states. They don't have HIPAA. They don't have this concept of the privacy of data. In fact, all they want is data. So they're coming and they're actually taking data on the US population through our systems, and they're using it to train their AI models. And they don't have constraints around that. And that allows them perhaps to even accelerate their models in advance of countries that have a kind of a different value system or a way to think about it. So I think the whole issue around security and data and training employees and making sure that people are not allowing these phishing attacks to happen is so critical, because it's just one little thing. At Athena, we have 180 million patient records. That's a lot of data. So you got to make sure that you're covering that.
Yeah, sensitive data too. And if you look at one of the interesting stats, we're either in the year now or it happens next year, where the cyber crime, the money these bad guys are getting from these exploits is now surpassing all of the illegal drug trafficking in the world combined. So you're seeing all of these cartels and these organized crime units shift to have digital arms so they can create malware, they can go after where the real money is, which is not the opioids and the drugs that we see. Those are deadly and important, but it's these cyber crimes, and that's only going to exacerbate these issues, particularly going after the data.
I'd love to come to the audience for a question in just a second, but I have one more for you. Folks, are we worried about, we've been talking about these concerns for years and years and years and years, especially at the Fortune 500 level, okay? It's it's not new. It's a matter of if, not when, right? And so are we concerned about the additional fallout from the Change incident, whether that's regulation, God knows there will be fines, just as business leaders, what are you concerned about in the aftermath?
Yeah, look, I don't know if there's more fallout that I'm concerned about. I mean, look, cybersecurity is an inevitability. To think it's going to abate and go away, I think is just being naive. It's going to continue to happen.
Sure.
I think the benefit of change is the resilience, hopefully, that is coming out of the system. So it's additional redundant connections and connectivity points. It's people that actually had a chance to exercise, going to paper and thinking through how they're actually going to operate in a non-digital world. So I think, if anything, there is a small silver lining that comes out of this, which is the ability to practice and learn how to react to cyber incidents that actually drive a shutdown of a major kind of national system like that. So I'm actually optimistic it'll be helpful long term.
Right on. All right, let's go to the audience for a question. Yes, we've got one right back here, please. Your name and your affiliation, please.
Yeah, Venk Vardhan with Nanoware. I want to touch upon, Bob, your last point, and I think it's a tie-in to the previous panel when we talk about consumerization and the human element that you guys all talked about. We're getting numb to these hacks, right? I mean, AT&T was just hacked, Experian, United Healthcare. The consumerization of every other industry, we're just voluntarily sharing data, the human aspect that you said. Culturally, or maybe from a policy standpoint, how do we kind of shift that mindset into healthcare where, Bob, your point about HIPAA and not existing in other places is actually in some respect holding us back in being able to deliver better care, because we get so up in arms about, oh, my healthcare data is gone, but all my Instagram data is hacked and that's fine, or we're numb to it. Just curious on like the cultural aspect and the policy aspect.
I have a lot to say about this. So I'll
Take it away, Andrea.
Thank you.
Go ahead, Andrea.
Yeah, if I may go. So I'm going to talk about my origin story here. Back in 2018, after Cambridge Analytica, we started the Light Collective because we saw how Facebook profiles could be scraped to create predictive algorithms and analytics about our consumer from our consumer data about us to predict our behavior. And I was asking a simple question, which is, how does that impact our health data when we share from vulnerable patient communities on social media? That moved on to doing some research in 2022 and a proof of concept around how Metapixel and other cross-site trackers or surveillance trackers could be installed in HIPAA-covered entities in order for us to target ads to people. And as it turns out, these pixels or ad tech tracking technologies are rife within the healthcare industry, leaking data at a scale that we haven't yet seen. There's been a wave of federal and state class action lawsuits and a definitive ban on tracking technologies on HIPAA-covered entities' websites. The irony here is the American Hospital Association is fighting these ban on trackers, even though it's leaking data at a scale that we've never seen. And they're fighting it because of the liability. So I really think we need to take a different approach when it comes to thinking about health systems as a business entity and who we're protecting. Are we, when we have a fiduciary role to a company to maximize shareholder value, are we really talking about protecting the patients and the physicians who are, at a point of care, or are we talking about protecting our liability and our business assets? I really think that we need to shore up our consumer privacy laws, especially health privacy here in the US, because if we're leaking these data, and as our other panelists mentioned, using those data to train AI, and there's this arms race going on, we are in a very difficult place where ransomware attacks are only going to become more prevalent and easier.
We're nearly at time, so I'll ask you just the lightning round version of that, which is, Bob, Stephen, can we change culture sufficiently to address these problems, if I may?
Boy,
yes.
Can you change culture? Even in an organization, it takes like decades to change culture. And look, I believe consumers have an individual liberty to do what they want, and to try to start to dictate what consumers can do with their information and what they consider to be hypersensitive or not sensitive is a really slippery slope. So I think, the best thing that we can do is just making sure that we're protecting people's options, and where people do have tighter restrictions around the way that they want to manage their personal data, that the industry is responsive to that. And we are not a facilitator of that data being exposed in a way that they don't want. But if someone wants to expose their medical record, online to somebody, who am I to say that they can't do that? So I do think it's tricky. I think the industry has to make sure that we can match the privacy needs of each of the individual consumers.
Right on. Stephen?
I would just add a quick, there needs to be alliances. Public, private, academia, individuals need to work together to create over time a much better posture for bad actors to have to go against, but also force them to understand what is the real important data of a company. Do I treat my medical record the same as I treat my credit card statement, that I treat my social media profile? It also forces everyone to say, these are the crown jewels, these are what we protect at all costs. Not every data structure is going to be treated the same, and we can put a lot more controls once you have that identity done in your organization or your health system. And I think that's important too. So you're not protecting everything the same, and you bring together these constituents to form a much stronger posture for bad people to have to go against.
Well said. This was a wonderful conversation. Please, a round of applause. Thank you, all of you.